Good morning. It's a pleasure to have you with us today, Miryam Gerdine, a public health leader, and we are APHA 2018. Miryam, can you share a little bit about you and your work?
Okay. Well, buenos dias, Jose Pietro. Good to have been part of the breakfast this morning at the Helen Rodriguez Trias breakfast. I think this is the 45th Latino Caucus program. So felicidades to you as the leader,
Gracias.
as the president for the Latino Caucus. It was an amazing program this morning and so far to the conference. About me, okay, Miryam, I'm a public health analyst, social scientist at HRSA, at the Health Resource Service Administration. It's a sub-agency of HHS. I was very fortunate many moons ago in 1996 to be the CHCI Edward Roybal Public Health Fellow, and that's how I landed at HHS, working on healthy people, and specifically the Healthy People Hispanic American Progress Review, which was tremendous opportunity. And that's when actually I learned about EPHA and Latino Caucus.
Great.
It was actually Henry Montes, who I think saw me confused and bewildered in this big conference and said, let me take you over to Latino Caucus. And I came and joined. And at that time, the student membership was only $5. And I was like, that's a great investment. But more about me, my family's from Peru. I'm an immigrant to the United States. I came when I was 7. Very fortunate to have strong parents to support my educational growth. I went to Penn State for undergrad. I went to BU for social work school. And then in 96 took a break and got the CHCI fellowship, came to HHS. Then in 2001, I started at Hopkins, a master's in public health. And this last spring, gracias to another past Latino Caucus president, Doctora Fanny Francesca Becker, I became the new co-instructor for the Latino Health Indicators class at Hopkins now. So now I'm also an associate professor at the school. So I'm a researcher, a scientist, a new mom. I've got three kids, but an immigrant to this country, first in my family to go to college in the U.S., and a federal servant.
Wow, that's quite a career. Congratulations.
Yes.
So tell me, why public health?
You know, it was really interesting. I learned about public health through my practicum when I was a social work student.
Okay.
I was doing my MSW at Boston University, and my field placement was working with women who were recovering from substance abuse. And so that's how I learned about public health, through my social work experience. And then one of my professors at school said, you know, there's this CHCI fellowship, you should look into it. So that's how public health found me, you know, through the fellowships and those opportunities. And then I came to the conference, APHA, and Henry found me. And then he took me to Latino Caucus, and then I found it. So why public health? Because it's, I guess, critical and a foundational for all our lives. Greg talked earlier this morning, Dr. Talavera, about, you know, public health and all the different sectors of it, you know, the environmental health perspective of it, the housing, you know, education, the social determinants of health. So I think public health is one of those foundational that makes a difference in all our lives. So I think it's a, you know, it was a way I found it through social work, but it's critically important, so it's a foundational. So that's why I love public health.
Great. And I know you mentioned social determinants.
Yes.
For those who don't really understand what that means, would you like to talk a bit about that?
Sure. So I was very fortunate to work with the Healthy People Initiative at the time when we were looking at Healthy People, you know, 2010, 2020. And then we had an amazing leader, Dr. Kamara Jones, who was part of CDC at the time and was our chairperson for our Social Determinants of Health work group. And then about the importance of integrating that within Healthy People, of not only looking at health, at, you know, disease status, but also looking at the environment, looking at people's, you know, looking at the complexities that we live in, you know, looking at housing issues, looking at educational opportunities, looking at racism, sexism, you know, all the isms that there are, sort of looking at the broader lens and understanding that it's not only about the health outcome of, you know, you're diabetic or not, but of really looking at the broader picture and how that's all factors and how all that plays into someone's good health. So that's the way I see it, as just, you know, all those other sectors, how we come together and being mindful of how all that interplays in someone's access to health, how they seek out health, how they get the treatment, and how they recover too, either from substance abuse or an injury, whatever it is. But we need to look at it a lot broader. So I think I learned that through my work on Healthy People, and again through Dr. Kamara Jones' work with us on Healthy People.
So it sounds like health, it's very complex, and
Yes.
it takes different levels or different approaches of multiple people, organizations, to make sure that the individual receives the proper care, if I understand you correctly. But talk to us about Latino Caucus. You being a former president of the Latino Caucus. What is the Latino Caucus? What is the Latino Caucus trying to achieve?
Yeah, well, I was very fortunate to learn about public health also through the Latino Caucus, because as I said, I had social work training, and I didn't have my MPH my first 5 years coming to conference, so I learned about public health through the Latino Caucus, through the scientific programs, learning about people's programs, their interventions, their results, their research, the students' posters. So I think that's been a tremendous asset for all professionals to highlight their work, disseminate findings. I think that's an excellent way to, share the science, share the data, and also, looking at our 3 pillars, as I stated this morning, the sharing, the collaborating, the mentoring. It's so critical, as you said, to collaborate. It's complex. Public health is complex. We cannot do it alone. We don't want to do it alone. It's exhausting to do anything alone. We need partners. We need key partners. So collaboration is an asset. And I think that's where Latino Caucus also is really good in terms of collaborating with the other caucuses or other sections. I know in the past we've done, award programs together, share costs, leverage resources. So that's critical. And also the mentoring. I felt like, through my relationships, peer mentoring, contigo, ¿no es cierto?
Right.
And with others too,
Right.
who were at APHA a little longer, learning from them, and also learning from the young people like Paulina. I remember she was a student.
Yeah.
She's a VP now, so it's like learning and getting the energy from them. So that mentoring goes in many directions. Peers, you and I,
Right.
people who've been in the field a lot longer in terms of APHA, and then the young professionals of getting their energy and their ideas. Oh my God, they've got so many brilliant ideas, and I love hearing them and helping support them to implement. And I'm super excited about tonight's, initiative, all the Latino voices, and then kicking it off. So I think the Latino Caucus has really served a really huge need, because I remember Helen Rodriguez Trias telling me that there was one year when they had invited Cesar Chavez to be a keynote speaker at
Right.
APHA, and he was not invited, and they wanted him to be at a small session, and many of the leaders were like, "This is Cesar Chavez. You don't do that to Cesar Chavez," and that's how the Latino Caucus actually got established, and founded.
It was
So I
more
think
like a reaction.
yes, yeah. So, but I remember, hearing that. So it served such a huge need in terms of giving voices to
Right.
our Latino researchers, and I will say also non-Latinos, because there's sometimes presentations where we have other cultures authors presenting, but it's the work on the Latino community.
Right.
Because I do believe that we all have an opportunity and a challenge to help our Latino
Right.
community. It's not only Latinos, but everyone. That's another reminder I had in my class. We had 13 students in the Latino Health Indicators class at Hopkins, and not all of them were Latino. We had a mixed
Correct.
group. We had some
Yeah.
Asians, African Americans, some white, Caucasian students, and so it's important because everyone's serving the Latino community,
Correct.
and we need that collaboration within our Latino circles,
Yeah.
and also outside of our Latino circles.
And I know you mentioned giving a voice. You mentioned the young people. What is the vision, or what would be your your wish list for the Latino Caucus in terms of the young having a voice?
More participation through the conference, yes. So we've been very fortunate in the past. The California Endowment had provided, scholarships and stipend support. So I think if we can have more of that, so that they don't have to, dig into their pockets, because they are limited with resources. So if we can have more students presenting. Actually, this morning at 7 o'clock, I was at the Public Health Social Work business meeting, and they were talking about how can we get more students to submit abstracts. So how can we, as Latino Caucus, also try to submit, encourage more students to submit their work. And I know, I'm in Bureau of Health Workforce, and I talked to my project directors all the time about encouraging their students to submit abstracts. And sometimes the students feel like, oh, I'm not really doing a lot. I'm just doing a small role. But giving them that opportunity to present their work. And actually, Dr. Napales earlier this morning said it too. Sometimes we are very humble with sharing our work. We don't think it's, or even Greg said it, I don't think I deserve this award, you know, but it's like, no, just acknowledge and accept that you're doing this great work. It might look small in your lens, but you never know how it could teach someone else. So I think we need to continue to support more students coming to the conference. And I love what the communications committee already did, the videos that they posted on Facebook. I think that's really clever because it gets that excitement. And you know, I couldn't arrive till yesterday, so I missed the awards dinner on Sunday because I had my family obligation. But I saw the video and I was like, oh, next year I got to make sure I'm there.
So it's, you know, us inspiring them, they inspire you.
Claro que sí.
Miryam, thank you so much for talking to us. You know, thank you for being a leader in public health, and thank you for, you know, being a leader also for the Latino Caucus, especially for the, you know, the young professional students. So, and thank you for, you know, talking to our audience.
No, gracias a ti.